Hello, and thank you for joining us for the 2024 North Carolina Medical Society Candidate Series. We've been interviewing all of our members who are running for state or federal office this year. And today I have Dr. Stephen Feldman, who is running for North Carolina's 10th Congressional District. Thanks so much for being here, Dr. Feldman.
Oh, it's my pleasure.
This is the first question we've asked all of our candidates, and I'm very interested. What has motivated you to run this year?
Yeah, there's so many things. The main thing I would say is that medicine has taught me that people in different groups are all really nice. I often am told terrible things about drug companies and insurers, but when I go and talk to them, they're actually really good folks who also want to help people. And I see that across our political divides. And I'm hoping to bring a sense of civility to help us answer the critical issues that are facing us today. I'm running for a national office. The national debt is crippling our country. It's going to impact healthcare in a big way.
That is a big issue, and it's a big issue important to a lot of our members and the people of North Carolina as well. But coming off of the national debt, I want to talk about our rural population here in North Carolina, which is something I'm sure you're aware of. It leads to big gaps in healthcare across the state. So I want to ask you first, if you're elected legislatively, do you have any plans or thoughts to how to improve that gap for the people of North Carolina?
Yeah, absolutely. I'm coming from a bit of a libertarian perspective, and I think it's a very practical way of looking at things. It's the idea that instead of thinking that the first solution to every problem is more government, the first solution to the problem that we should consider would be less government interference, giving people more freedom. And I think when it comes to access to care, government regulations may be well-meaning, but they may be counterproductive. We've seen this in medicine all the time. I'm a dermatologist. Regulations on our lab make us give up doing lab work, and it doesn't help patients. And I think the regulations that limit who patients can see are counterproductive for rural access. So greater access to physician extenders, to using doctors over the internet would be ways you could have rural access. Getting rid of the regulations, again, well-meaning regulations that just make doctors want to retire sooner, or prevent retired doctors from seeing patients. Those doctors could be helping people in rural areas.
I think that's a great thing to think about. And you had mentioned several things about government interference, not government interference, but necessarily government programs that may be interfering. And one of the things a lot of our members asked about is that North Carolina has an older population in a lot of areas, and they're concerned about Medicare. They're concerned about what's going to happen to it in the future. Our members are concerned about what they're getting paid. It's really a big issue for people. I just wondering what your take on where Medicare is right now and what, if any, changes you think need to be made.
Yeah, I think people have a right to be worried about Medicare and all government programs. The deficit just keeps adding to our debt. The debt is already a large percentage of federal expenditures. Medicare expenditures are growing, and it's just not sustainable. We want to leave our children a country as strong as we received, and right now we're just leaving them a pile of debt. I think Medicare needs to change in a big way. Look, medical resources are not infinite. So somebody has to control the cost of care. Right now, with this third-party system, people don't have an incentive to choose cost-effective treatments. Doctors and patients love the idea of being able to do whatever's best for the patient, no matter what it costs, but that's just not a practical solution. I think the answer to Medicare is what made America great. It's the free market. I think we need more market-based initiatives that give people an incentive to choose a therapy that's best for them at a price that's reasonable.
And if you were elected, what would be your message to these Medicare patients in North Carolina?
My message to Medicare patients would be that we need to move them to a system where they take some personal responsibility for the cost of care. I think the government system can, for example, be a high deductible plan where people have an incentive to call around to different hospitals when they need a lab test to find out who's got the lowest price. If they had that incentive, then healthcare providers, drug companies, hospitals, would be competing on price and quality like everything else in our health, in our economic system. It would bring down costs and it would improve quality.
Perfect. That's a great message. I want to ask you about this because it follows out of that. Something a lot of our members are talking about is prior authorization. And I know a lot of them are very passionate about what they feel about it. It really does affect both providers and patients. So what's your take on prior authorization right now? And I know there's no crystal ball, but looking forward, what would you like to see happen?
Yeah, so prior authorizations are a huge hassle. I specialize in psoriasis, and we're giving out these $50,000 a year drugs left and right and go through a lot of paperwork to get them for our patients. Big hassles. And we're even seeing prior authorization hassles for like older generic drugs. But I understand it, and I don't want to stop it, at least not in the current system. Again, healthcare resources are not unlimited. Right now, we count on insurers to control the cost of treatment. I don't think we want to move towards a government-controlled system where government tells us what we can and cannot have and determines the price. I think we need to, as long as the insurer is controlling the price, they have to have tools to do that, or hospitals and drug companies could charge $1 million for a day in the hospital or for a dose of a drug. Ideally, we would move to a system where patients have an incentive to address the cost of care themselves. And then we could get rid of all the prior authorization paperwork, and patients could get the medicines they need immediately.
And getting rid of prior auth is something I think a lot of our members would like to see. I have another question for you, and you mentioned telehealth earlier. The world is moving very quickly right now when it comes to healthcare. There's a lot of things on the horizon, actually not on the horizon so much as happening right now. Things like AI, more telehealth. There are a lot of the opioid crisis is being addressed in lots of different ways. Just when you look forward over the next few years in terms of healthcare, what do you see happening? What are your priorities if elected to make these things happen? And what do you think the next steps are?
Yeah, the resources people have available to get medical advice over the internet is just phenomenal. Yeah. I think ChatGPT was tested versus medical students and did a better job providing care, and shockingly was more empathetic too. The COVID epidemic caused us to move towards a whole lot more telemedicine and caused us to eliminate some of the restrictions on cross-border care of patients. And it proves that the regulations limiting that cross-border care were counterproductive. So hopefully we've learned our lesson. We're going to see much greater use of these internet resources.
And you mentioned telehealth and cross-border. Do you think, and COVID, do you think it's really going to be something that's going to be effective for all doctors and practitioners, and telehealth is going to become one of our baseline ways to treat patients? No crystal ball. I'm not asking you to predict, but it feels like there's a lot of things moving that way.
Yeah, I think so. Look, I'm a dermatologist, and so I can see the skin surface. Yes, it's better in real life, but you could do a lot of telemedicine. And patients love telemedicine. However, I have found that telemedicine is inefficient. It's much more efficient in the office to provide the care. And so I don't think we physicians are going to want to move all our patients to telehealth. That said, if the people of the 10th District elect me to Congress, I'm going to end up seeing a lot of my patients by telemedicine at night.
Yeah, that will be your next step, won't it? Well, thank you so much for talking with us. Great conversation. If people want to learn more about you and your candidacy, how can they find you?
Well, it's been a real pleasure speaking to you. If people want more information, they can go to stevefeldmanforcongress.com. I've laid out a lot of positions there.
All right. We've got all that on our website as well. Thank you very much, Dr. Feldman. And thank you to all of you for watching today. Our candidate series will continue through the next couple of months until the general election. So thanks for watching. We'll see you next time.